What I notice is a lot of people may feel like the surgeon is going to fix them, but they're not really taking personal ownership and responsibility for their health. And there's actually a lot of things that we can do to optimize outcomes, especially surgical outcomes. So where the mind goes, the body follows. And we're going to be talking about in this class specifically using essential oils to support us. But I will be popping on later. I'll do another video on this with other tips and things to prepare for surgery. And if you're not following me on Instagram, you want to go over and follow on Instagram because I've been sharing a lot on my Instagram stories about what I'm doing to prepare. Everything from nutrition to supplements to how to get your medical records. All of that is really, really important information with this. And if you're new to me, I'm Dr. Laura Ricci. I have a doctorate in physical therapy. I'm a national board certified health and wellness coach, and I educate people and sell essential oils. I'm very passionate. My big why is to empower people to become the CEO of their health and wellness. And we're going to talk all about being an empowered patient and surgery in this class. If we have anybody who is brand new to essential oils, maybe you don't know what essential oils are. Basically, they are natural aromatic compounds. They're from plants, and I think of them as the plant's natural protection from environmental threats. Think insects or decay. They're pure extracts. They come from seeds, leaves, bark, peel. There's no additional processing or ingredients with them. They are very concentrated. They're fast acting. They're quickly absorbed into the skin. A little goes a long ways. And we're going to be talking about 3 different ways that you use them topically, which you could be using for muscle or joint discomfort. Maybe you have a skin irritation or a little bit of occasional redness that comes up for immune support, which is a hot topic right now. You can use them aromatically. So I've got my diffuser. You're going to see my diffuser over here kind of randomly turn on and off intermittently, but you're getting that emotional support, respiratory support, cleansing and purifying the air in your environment, also important. And then internally, which we could use for lots of different things, from emotional support to digestive support to immune support. We'll talk about those specifically related to surgery. Now, please, this is my little warning. One, the information that I'm going to share in this class, it's not to be taken as medical advice. I am sharing education from my own personal experience and research. And I always want you to partner with your qualified healthcare professional and your doctor and your surgeon and work in partnership with them. This is education. Second, please don't take the information that I share in this class and go and buy oils from Walmart or Amazon or the mall or the health store and expect to get the same results that I'm talking about with doTERRA. The big difference with doTERRA is that these oils, where we source our plants and where we get our oils from, are sourced from their indigenous regions, basically where the plants are designed to thrive and grow. We want plants that are grown in their best environment, in their natural habitat, because they're going to be stronger, they're going to be thriving. Everything from sun exposure, moisture, soil compounds, time of day that it's harvested, weather, all of this impacts the plant. Ask any farmer or gardener and they'll tell you that. And so we source the best and we also help the most. So there's a global impact when you purchase a bottle of doTERRA essential oils. Not only do we get these beautiful essential oils, but we support families all over the world through doTERRA's co-impact sourcing. And this allows farmers to care for their plants, to supply them with a great income, to help change the lives for their family. I have seen this firsthand when I went to Kenya in November, and it was incredible. I got to be in the tea tree farms, in the geranium farms, meet the farmers, see how a farmer, Gladys, that I met was able to send her son to college, was able for her children to get an education after her husband passed away because she's a farmer for doTERRA, and extremely grateful. So I cannot look at these oils, look at a bottle of oil without seeing their faces and seeing the farmers. So know that that's so powerful. There's third-party testing done on our oils, over 54 tests, to make sure that they are pure, that they are unadulterated, that they are, we like to say, better than organic. On the bottom of the bottles of essential oils, you're going to see a little code here. And you can go to source2u.com and type in that code and pull up the third-party lab testing for your batch of oil. That's really, really powerful. I don't know any other company that's offering full transparency with this. So especially when we're talking about using oils around surgery to support us with our health and wellness, we want to make sure that the oils that we are using are pure and safe, because whatever, especially if you're taking it internally, but if you're using it topically, whatever you put on your skin is going to be absorbed into your bloodstream. So this is all very important stuff. Plus, I love the heart of doTERRA. So they have the Healing Hands Foundation, which seeks to donate and provide aid to those in need. They build homes, they provide food, cleaning water, clothing, education. I saw firsthand little girls in Kenya getting to go to school because of Healing Hands and doTERRA. I saw clean water initiatives and clean water drinking fountains in Kenya because of this. doTERRA also partners with Operation Underground Railroad to donate and raise awareness to end childhood sex trafficking and provide healing and hope. So I want you to know what's going into all of this before we dive into more of the protocols and different things there, that one essential oil is not like another, just like with supplements, just like we do our research and our due diligence when choosing a doctor, when choosing a surgeon, when looking at organic food and supplements, same thing, and the quality needs to go into your essential oils. So I want you to know that going into all of this. That is why after a lot of research, I've chose to partner with doTERRA and love these oils. And I've seen them support me through many different challenges, many different surgeries and upcoming surgeries. So those that don't know, I was diagnosed with adult hip dysplasia back in 2014, and I have had 3 hip surgeries on each hip. One was a periacetabular osteotomy. Osteotomy means to break the bone. So they actually broke my pelvis in 4 places, repositioned it to get better coverage, and then put some large screws into place. One of the biggest orthopedic surgeries you can have, much bigger than hip replacement. To just give you a little background of where I was, on a walker for 6 weeks. And once those all healed up, we did a surgery to remove the screws, to remove all of the hardware that was in my hips. And then I had impingement and labral tears that kind of surfaced years later. And we did scopes in each hip. And then now we're looking at doing some more hip scopes. So it's been a little bit of a journey. And I think of it as kind of peeling back the layer of the onion in different areas of healing. I think sometimes people feel like surgery is a failure. And this is where I'm going to talk to you a little bit about mindset. We're going to get into the essential oils. But there's a time and place for support, for help with that. And even myself as a physical therapist, we're very conservative. We don't necessarily rush into surgical treatment, but there's a time and place. So I want you to know that I'm not against Western medicine. Western medicine has saved my life many times. Those of you that know, I'm also a cancer thriver, had a sarcoma in 2011 in my abdominal wall, size of a softball. Western medicine has saved my life. So I'm not anti-Western medicine. What I believe is the secret sauce is combining the best of both worlds and empowering patients with a holistic approach, with looking at nutrition, with looking at essential oils, as well as using all those resources of some amazing doctors and surgeons that can help us, which is really powerful. So a lot of the information that I'm going to share with you today is from Robert James. So he's had a long time use of essential oils, and he's compiled some notes and some surgical protocols that he uses. Also some things for my own education and resources and research that I found, and my own personal experience with using the oils with a lot of different procedures. So pre-op, if we're talking about starting to use the essential oils before surgery, using some calming oils is going to be really helpful. And that maybe look different for everybody. I love the oils for emotional support. I came to oils for physical support. The emotional support's been my favorite way to use them. And these are going to be things like balance or adaptive or serenity. I love citrus bliss and elevation and cheer. I love the citrus oils because they're very uplifting, especially as we're going into fall and winter time. If you notice that affects your mood, they're very uplifting. You'll also notice in this class that I'm going to be speaking compliantly. So come along with me on this journey, and I'm sure you can figure out things that I'm saying. But notice too that we're going to use compliant language when talking about the essential oils, but this can help with mood. And we really want to go into surgery feeling peaceful, feeling calm, feeling supported, feeling ready. So if you're already getting those pre-surgery jitters, start with the emotional support right away. That's really, really key. I would recommend you drink plenty of water and use lemon essential oil. And by the way, a lot of these recommendations are going to be good for people in general, regardless of if you're preparing for surgery or not. But drinking lots of water, and I would add a citrus oil into that, like lemon or tangerine or grapefruit or wild orange. These are very high in limonene. This is a chemical constituent that actually helps to support the body in producing glutathione. This is the body's natural antioxidant, master antioxidant of the body, to have that on hand. Now, I would also recommend taking your Lifelong Vitality Pack. I like the little packets because it's easy for me if I'm traveling or on the go, or there's different supplement cases and holders and things to have your LLV. But taking a high quality multivitamin, multimineral, and LLV is actually 3 things. So it's our vitamins and minerals, the Microplex VMZ. It's the XC Omegas. This is your fish oil. And then it's the Alpha CRS Plus, which I believe is the secret sauce of Lifelong Vitality Pack. So this helps with mitochondria, cellular energy, detoxification of the body. Now, most surgeons, physicians, doctors are going to have you stop your supplements about 2 weeks beforehand. So this is where you work with your doctor and you have these conversations and ask them what that looks like. So know that that's a possibility, but you can take them up to then, that 2-week mark, and then after. So talk to your doctor, work with them as to what to do with your supplements and what that looks like. In the weeks before you go to surgery, I would recommend doing an Aromatouch technique. So this is an essential oil application. You can actually Google doTERRA Aromatouch. There are videos to show you how to do this. There are different trainings that are available to go to, but it's using 8 essential oils and they're applied on the back and the bottoms of the feet to help to relax the body, help to support your immune system, help to bring that homeostasis in. Very, very powerful technique to do. And something simple, something that a family member could do. Or depending on where you live, there may be a spa or a massage therapist that's certified in Aromatouch technique that could do this for you. So reach out to your resources. Another resource that you could do is Symphony of the Cells. I actually have the book right here. So this is Symphony of the Cells. You can go to symphonyofthecells.com. You can purchase the book. And Symphony of the Cells has very specific protocols in there for different things. It takes only 5-10 minutes to do a protocol. And very similar, you're going to apply the essential oils on the back and the bottoms of the feet. So this would be a great thing to do to really help the body to prepare. Now, about 2 days before, we want to start using oils like Balance or Vetiver or frankincense. These are very grounding oils. And you can massage that into your shoulders, into your neck, into the brainstem, kind of the base of the skull right there. And this is going to help to release stress and strengthen the emotional response that you're going through with all of this. You know, when you're a patient, it can be emotional. And again, and I would combine this and actually recommend doing this with meditation, bringing more mindfulness in, that mind-body connection. That's a really powerful thing. Daily, for the week prior, maybe even 2 weeks before. And honestly, we're in an interesting time now in the world that you could just do this every day. You could put a little bit of Angar on the bottoms of your feet. So Angar is our protective blend. This is basically like the toilet paper oil of doTERRA right now. So this would be a great one to start using to put on the bottoms of your feet, to diffuse in your home. Honestly, even before all of this stuff happened, we do a lot with diffusing this basically fall until springtime, to cleanse and purify the air, to support our immune system, all of that. Angar is one that we use a ton of. Okay. When you are, say, getting blood drawn or getting an IV put in or placed, here's a few of my tips for you. You could use something like Clove. Now, no, both of these oils are hotter oils. They're spicier oils. So you may want to use a carrier oil with this as an option. I like to use it neat for me personally, but it's a hot oil. So if you're a new oiler, you're not sure, do a little skin test. You can always add more carrier oil if anything ever gets uncomfortable. But Clove has some numbing agents and properties. Clove is actually used a lot by dentists, back in the day to numb the gums for oral health or procedures. So clove is one that I like to put on if I'm getting an IV put in my hand or my arm or something to numb that area. Another nice oil that can help with numbing is wintergreen. So you could do a combination, you could do one or the other, but put that on. So maybe you're having an injection or getting poked or something like that. I like to do this to kind of numb the area. Clove is free for doTERRA customers. Today's the last day to get it, the 15th, with your qualifying loyalty order. So clove is a nice one to have in your arsenal to help with the numbing and any discomfort. So I like to do that personally before I'm getting poked. Now, if you're somebody who maybe you're a hard stick, maybe it's hard to kind of get those blood vessels to come to the surface, you could use a little bit of Balance essential oil. There's some really interesting videos on YouTube, you can search them, about Balance and how it's really oxygenating to the blood and to the red blood cells, and really helps to support our body in that way. So you could put Balance on that area there, that antecubital fossa, that bend in your elbow where they're going to do a blood draw or something to help bring that about. And it's a really great grounding oil. So you're going to get the emotional support from that. If you're somebody that maybe doesn't love to get poked, I don't love to get poked. Like we said, I've had a lot of surgery and I still don't like that. So that would be a great one to do as well. For emotional support, Adaptive. I like to diffuse Adaptive. I love the Adaptive Touch roller, and you can roll it on, you can put it over the heart. If you have a scarf or something, you can smell it, you can inhale it. I like to put it in my hair, but have some oils on hand to support you emotionally with all that's going on. Now, as soon as possible after the surgery, well, let me go back a little bit talking about Aromatouch. So there is an Aromatouch hand technique that you can do. Again, you can find these videos, doTERRA has videos, and you can apply essential oils. You could really pick whatever oil it was. If you needed emotional support, maybe do Adaptive and roll Adaptive in your hand and have somebody give you a nice little hand massage. And there is an orthopedic surgeon who was speaking at convention, and he actually has a licensed massage therapist on staff to give Aromatouch Technique hand massages and foot massages before surgery. And he said the family gets lavender or calming oil to help calm them down. The patient could get some peppermint or ginger, something for a little bit of digestive support to have on hand. And the patient gets a hand and foot massage. And they did this research and found that they were more calm, that their blood pressure went down, that their heart rate went down. Can you imagine how awesome that would be to have a little massage pre-op before you go into surgery, so you're feeling calm and relaxed and all of the things? I thought that that was pretty interesting. I am hoping more and more orthopedic surgeons and doctors all around are going to jump on that. And he said after surgery, everybody gets a Digestzen soft gel. So when they wake up, they get 2 Digestzen soft gels to have on hand. So this is for digestive support. This is a really nice one. And for me personally, I don't drink alcohol. I don't take pain medications because I just don't tolerate them well. I don't feel good on that. And I have a hard time with coming out of anesthesia because of the nausea and the vomiting and just tossing my cookies. That happens a lot. So what I found, I never thought about using the Digestzen soft gels until I saw that at convention. But what I personally had done in the past is when I wake up, because it usually hits me a little bit after I wake up, is I will take the Digestzen, I will do a drop on my tongue, I'll put a drop in my hand and rub it on my tummy. And again, this is a spicy one. So if you've got sensitive skin or little ones, you're going to put some coconut oil on there. And I will just inhale it. Just smell it right out of the bottle. And I do not toss my cookies. Was a game changer for me, because before I had essential oils, I was always sick. And this changed everything. And actually, interestingly enough, it was one of my surgeries in Houston for my hips that the nurse said, "Who has Digestzen?" She came in and she knew doTERRA and uses doTERRA in her home. And it was really fun. And actually at the surgeon in Colorado that I saw recently, their staff, their physical therapists and athletic trainers, they were all very familiar with doTERRA, which made me feel awesome too. So Digestzen If you don't love Digestzen, you could do something like lemon or peppermint, but this is going to be a really great one to add in. So grab your Digestzen soft gels or your Digestzen oil and use that to help you if you're somebody who tosses their cookies after. Now you can use something like Cypress oil or basil oil. These are really great ones to put around the area. You're not going to put essential oils on the surgical site. Not until that is completely closed and healed, and then we can use some oils to support with scars. But until then, you're going to go around. You're not going to go on. And honestly, there's probably going to be bandaging and everything else. So we want to leave that alone. You can just go around, or you can put the oils on the bottoms of the feet for those reflexology points. The spine, as we talked about, really great places to put the oils. Or you can do the opposite side. So say you're having knee surgery on the right, you could put the oils on the left. What's cool is our body's really smart and it knows how to utilize those essential oils to help. And it's going to go to that area. So say you have a cast on or a big bandage or something, you can put it on the opposite side. The body knows what to do with it and utilize it, which is really cool. So if you're having any excessive bleeding happening, you could use your Helichrysum or get your Helichrysum Touch. Now that that's a permanent item that's pre-diluted with your coconut oil. And again, we don't go on, but you can go around or opposite sides or bottoms of the feet or geranium. Those are two really great oils that can help if you are needing a little bit of support with that. You can use lots of oils for discomfort, right? Maybe you're having cramping in the muscles after surgery or something's going on. So you can use Deep Blue, Aromatouch, or Past Tense, or a combination, or Deep Blue Rub. There's lots of options. So I had a uterine ablation a year ago, was September of 2019. And they told me that the worst pain from that was going to happen in the evening. So what I did was I kept Aromatouch, Deep Blue, and Past Tense. I used all three. And I kept them in the bathroom, and it was my cue. After I would go to the bathroom, wash my hands and everything, I'd roll it on my lower abdomen over the uterus and my low back, and I was fine. I didn't have any issues, anything like that. So use the oils, and you may find that you like one better than another or a combination of all of those. You could try copaiba, you could try frankincense. There's a lot of awesome options there, but use those to support the muscles. You can put frankincense, Angar, and oregano with a carrier oil, because remember, oregano is a very hot, spicy oil, on the bottoms of the feet to support the immune system. Because there are, because hospitals, right? And we want to support our immune system, especially right now with all that's going on. If the hospital would let you diffuse some oils, diffuse some frankincense, maybe frankincense and Angar, or arbor vitae and Angar, or add some tea tree to that. These are all really great cleansing oils that really help to support your immune system in your body. If they're hesitant, if they are not going to be okay with letting you have a diffuser in the room, make a little spritzer, make a little spritz bottle. You can spritz that around. You can use your Angar hand wipes. Who's super excited about these? These save me actually when traveling recently all the time. This is a great tool. So you can open these up, wash down your area, right? Wash down that table, wash down any handrails, remote controls, anything, and use those on hand. Wash down your phone, wash down your hands. It's great options to have these tools with us. Also, your Angar hand sanitizing mist. I have these in bulk. I'm using these like crazy. So do things that are going to help to cleanse your environment with you. Oh, awesome. Becca said that they let her have her diffuser. That's so great. Okay, let's talk about when you're intubated. So if you're under general anesthesia, they usually put a tube down your throat to breathe for you. And when you wake up, you can have a lot of dryness. You can have a lot of scratchy throat. I typically will get nosebleeds in those areas. So Helichrysum Touch, roll that down the bridge of your nose and have your Angar throat drops. I swear by these save me. And I start popping those in, and it really helps with that scratchy throat. You could also do a little drop of Angar and lemon in water, but it works very, very nicely for that. Just scratchy throat after you've been intubated. Great option for that as well. Little tip from experience with this. As soon as possible after surgery, start the Aromatouch technique and start doing that again twice a week. Oils on the spine, oils on the feet. There's videos to talk you through that, or trainings or things that you can look up, or start adding in the Symphony of Cells like we talked about. I want to start using those tools in your toolbox. So this is going to help to bring the body back into balance, back into that homeostasis, support your nervous system with all of this. What's really great about the Aromatouch is it helps with stress, helps with discomfort, immune support, and homeostasis. Those 8 oils are very, very powerful. So use those together. Now, again, a couple common things that come up with a procedure is the feeling nauseous, tossing your cookies, that kind of stuff. So you can use ginger drops. And these are great if you are pregnant or car sick or whatever it is, spun around the merry-go-round too much, whatever's going on. But these are really awesome to take before and after surgery if you're feeling nauseous. You can also inhale ginger essential oil or peppermint or lemon, but I love to use the drops. So I like to have the drops on hand for me. If you're getting backed up, sometimes we're not pooping because we're taking pain medication, and that can be really backing up with our system. You can use your Digestzen oil topically or internally, especially inside the belly button. And again, if you're gonna do it topically, use your carrier oil, or there's also a Digestzen touch roller. Make sure that that's diluted, but rub that on. And you can actually look up, there's a YouTube video called the I Love You, the ILU massage. And you can apply the oils and add this to this, but you actually go kind of starting here on the right side, on the inside of the hip bone, and you're massaging, and you go up to the ribs, across the ribs, and then down. So we start here, and we're this is the I, kind of working that down, descending colon, and then we kind of like come around here, the L, and then this is the U. So we're going right to left, and you can even go in circular motions here from right side to left side because we want to help that stool move down and out of the body. There's a bunch of videos on YouTube that will help you with this too, but I like to do the combination. So doing a little bit of massage if you can, and helping to get things moving. You could also try Zendocrine essential oil. So I like that as well for detoxification, especially if you're trying to detox anesthesia out and all of this stuff. You could take Zendocrine internally or topically as well, and use that if things are getting backed up. If you're having a lot of discomfort after surgery, I personally like frankincense, lemongrass, marjoram, and copaiba, tomato, and put a couple drops of each of those in a veggie capsule. So maybe 2 to 3 drops. You can take that every 6 hours as needed if you're having a painful experience, right? If you're hurt, discomfort. I also really love the deep blue polyphenol complex. So you could take these as well. I like to take 2 as needed, and you could add in the turmeric dual chamber capsules too. So depending on how you're feeling. If you're having a lot of swelling and you need a little bit of support, that's pretty common after surgery, you could do something like Cypress. Cypress is the go with the flow oil. So I think about Cypress a lot for circulation support. Lemongrass is another good one. I use lemongrass a lot for ligament support. I use marjoram a lot for muscle support. So you could use those topically. Basil, rosemary is another good one. You can make a roller bottle of rosemary, ginger, cypress, lemongrass, and basil. About 10 drops of each in a 10 ml roller, and roll that to the area. I also really love, if you want an easy button, Aromatouch. Aromatouch is a really beautiful oil for circulation, to help with swelling, and this has cypress in it, and basil, and marjoram, and peppermint, and lavender, and a lot of good oils in here. So this would be a great one to use. You could put the Zendocrine just to help with detoxification, bottoms of the feet, over the liver. So liver is on the right side of the body here, right under rib cage, kind of wraps around here. So you can apply that to that area as well to give you a little bit of support with the Zendocrine. And you could also do some oils for sleep support, because sometimes it's a little bit tricky to get good restful sleep after you have a procedure. So I really love Serenity, or the Serenity soft gels. You can diffuse Serenity. You can put Serenity on the bottoms of your feet. You can put a couple drops on your pillow. You can make a little lemon spray with a little bit of witch hazel or water and spritz that on, and then have the Serenity soft gels to help you with that, because sleep can sometimes be a little bit tricky. For immune support, I would take the Angar Plus soft gels before and after, or if you're traveling, anything like that. You could also do the Angar beadlets. So these are a nice option too. So the beadlets are teeny tiny. Let's see if you can see this. They're itty bitty little beadlet. There's 1/4 of a drop of essential oil in each beadlet. You can put it in your mouth and pop it. That's what I like to do. It's kind of like a cinnamon Altoid. You can swallow it. If you've got little kiddos that maybe they can't swallow pills just yet, maybe they have those little fruit pouches that they do applesauce or something, you could stick one of those inside and they can take that internally that way to boost the immune system. The Angar Plus soft gels are on guard, and then the little plus stands for oregano, melissa, and black pepper. If you've looked up melissa, that is a very valuable oil, one of our most pricey oils, and it's in the Angar Plus soft gels. So that is a powerhouse for immune support. So is oregano, so is black pepper. So it's a great option too, to really help to support your immune system, boost your immune system during this time, which is really key. So that's kind of the difference between the two. Angar beadlets, just on guard, 1/4 of a drop in each beadlet. Angar Plus soft gels is on guard plus oregano, black pepper, and melissa. So that's kind of the big guns. We typically grab the Angar Plus soft gels when environmental threats are high. And I would say we could all agree right now that environmental threats are high. So you can take those for a little bit of support. All right, let's talk about scarring. There's several oils that I love for scars. An easy button for me personally is Immortelle. Now, this is the anti-aging blend. We usually think about this as a blend more for skin and wrinkles and aging spots, something like that. But when you look at the oils that are inside this blend, there's frankincense, Hawaiian sandalwood, myrrh, lavender, helichrysum, and rose. These are our most valuable precious oils. And this is undiluted. There is no carrier oil in this. So this is very, very special. You could make your own roller with it. You could open it up and take a little pipette if you wanted, and pipette maybe 10 to 20 drops out. And you could put it in a base of, you could do fractionated coconut oil. You could do jojoba oil or emu oil. One of our friends in our oils family was talking about avocado oil is a really nice carrier oil to use specifically with scars, but you could play with that. I used Immortelle regularly after my surgeries. You may not be able to see this, but I actually have a scar right here. And I used the Immortelle over that, and it works great. Another really good one is Yarrow Palm. So if you don't have Yarrow Palm yet, this is a valuable oil. Use your points to get this for free. And this would be a great one to also add. You could make a roller bottle with some Immortelle and with some Yarrow Palm. Now, Yarrow Palm has the pomegranate seed oil, so it actually has the carrier oil with it, but that's a nice one too that you can use topically. You want to make sure that the incision is completely closed. Usually they don't recommend doing a lot of scar tissue work until about 4 to 6 weeks post-op. So work with your doctor, with your physical therapist, but you can actually start to do, once you get clearance, some scar work, scar massage. So you can go back and forth on the scar, side to side on the scar. You can make little circles. You can do some skin rolling where you kind of pick up and roll the skin. So combine the essential oils with that. Now, just like everything else, you're going to see the biggest improvement with using it daily use and consistency with that. But those are two of my favorite oils to use to help with scars and healing with that. All right. I think we covered all of the main things. Something to put in your little bag, right? In your hospital bag. Have your deep blue rub packets for aches, discomfort, muscles. Have some of your throat drops, right? Have your On Guard hand wipes to clean down things, and your hand spray to spray all those areas, tables, remote controls, anything like that, especially if you're going to be staying the night. Oh, and I do love this. If you haven't tried this, the lip balm is fantastic because you're probably going to get some dry lips, dry skin, you're on oxygen, all of that stuff. That can be a nice one too. And then start taking your lifelong vitality pack supplements as soon as you're released to do so, because you want to start getting those nutrients into your body to help you as your body is healing. If you're somebody who's really anxious, the adaptive capsules and maybe even adding the copaiba to that, copaiba would be a good thing to do. And if you are new to essential oils, if you don't already have an account with doTERRA, I would love to help you get started, and we can craft a health and wellness plan for you. Maybe you're having surgery, or maybe you're just looking to get rid of the chemicals or the toxins in your home, or start to support your health and wellness in different ways. And this month, one of my favorite kits, it's got a lot of the oils that we talked about, everything that you would really need to support you. It's the Home Essentials Kit. When you get started with that, you actually get a ton of these things for digestive support for free. And this is open to everybody. So you could do this for, if you already have an account with doTERRA, if you place a 200-point order, you get all these for free too, but you get the Digestzen soft gels for free, which were recommended to take when you wake up after surgery to keep from tossing your cookies. You get Peppermint. This is a really good one. Again, if you feel a little nauseous, if you want to smell it, if you get car sick. I also use a lot for head tension, for if you have a high body temperature, that you're really hot, that you need to kind of cool down a little bit. Peppermint's a really great one, and tummy issues. And then there's 2 roller bottles. These are from the kids line, but adults can use them too. I actually like it quite a bit. There's Tamer and Calmer. Tamer, if you don't love the black licorice smell that is Digestzen, you can use Tamer. And Tamer smells more like spearmint. It has spearmint and Japanese peppermint and ginger and black pepper and parsley. So it's got a more mild scent to it, and you can actually roll it on your lips and then give it a little kiss, and it will plump up your lips and taste like spearmint. It tastes really good. That way you're not exposing your roller to bacteria. So don't roll it on your lips, just roll it on your hand, and you can kiss your hand. But you can use this in the hospital and roll it over your tummy, especially your belly button, for digestive support, which is really great. Calmer is one if you have anxious feelings. So before going into surgery, you can apply this. Actually, believe it or not, the elbow crease is a great place to put oils for emotional support, behind the ears, over the heart. You can inhale. And this is also a really nice one for sleep. Bottoms of the feet, roll behind the ears. All of that is a really good one. So lots of options there. These 4 oils are over $100 value, and you get them free just this month. So if you don't already have an account with doTERRA, reach out to me. I'd love to help you and support you with that. If you're already a customer, make sure to grab your free clove oil, as well as all of these other free goodies, so that you have them on hand to support you, because you just never know. Okay, do y'all have any questions? Let me go back through the comments here, see if I missed anything. Oh, yeah. Penelope says she's been told Manuka is good for scars. Yeah, Manuka is good too. There are so many oils that are really great for scars. And the awesome part is you can layer all of them. You can use all of them. You can make a roller bottle with all of them, or layer them. And you may find that some work better for your body than others. There's so many awesome ones. Yeah, absolutely. So somebody asks, would these be helpful for tumor removal operation? Yeah, absolutely. Yeah, you can do the same things, have those on hand. I had a tumor operation removal, so I can tell you, absolutely. And at the time I didn't have oils, and I really, really wish that I would have. And I'll be popping on too. Just stay tuned over on my Facebook page or Instagram or YouTube. I'm sharing a lot on Instagram, but I will do another class just on tips to help you prepare for surgery. I wanted to go really in deep with the essential oils in this class, but I will be sharing more information, and we're going to be talking about things like arnica and homeopathics that you can use for support. And I actually really love this book, Recover Quickly from Surgery. Really good tips in here. And we're going to be talking about that, the mind body connection, other things that you can do, dietary recommendations, nutritional recommendations to really help optimize your healing. Oh, awesome. Yay. Yeah, it's so nice to have the oils on hand to support you when you need it. It's been a game changer for me and helped in a lot of ways. And it's just nice to have tools on hand. So my recommendation is get one of those little keychains. doTERRA sells them. I think they're $6.50. If you put in the search keychain, it'll pop up, and they have the little drams. And so take your favorite oils that you may need with you in the little drams. So you don't have to have the big bottles. You just have them there, and you have them on hand for when you need them. And then make a little bag. And honestly, if you want an easy button for this, the new wellness track kits, the monthly kits that are available, add in the immune kit. And that's an easy button that for 1 month, you'll get one kit a month for 3 months. You'll get all the tools that you need. Or add in the relief kit. That's all for aches and discomfort and any painful things that pop up. And you'll have those tools that you need. So if you really want to simplify it, I really, really love that doTERRA now has this option. It's just a perk as part of the loyalty rewards program as a loyalty order. But that just takes the guesswork out of it, and you'll get the tools and they'll just come to your home that you have them. And then there's an educational packet that shows you exactly how to use them, which is really cool. Do I have a favorite carrier oil? I personally love fractionated coconut oil. That's my favorite carrier oil. This one's my jam, just because it doesn't have a strong scent. It doesn't stain your clothes. It's not super sticky. It works really well for me. This is probably my favorite one. But I'm kind of curious, to be honest, because I do use emu oil. I've used that in the past for scars, and learning more about the avocado oil for scars and wound healing. I might play with some essential oils a little bit and see. I'll keep you posted. I've been sharing a lot of my journey over on Instagram if you follow me over there. Yay, so glad that you found this helpful. Yeah, I love my doTERRA too. Super helpful. Yay. All right, let me know if you have any other questions, or if not, I'll let you get back to your morning. But this is information that's really been a game changer for me, that has helped me so, so much along my healing journey with this. And it's a tool. I don't think that essential oils are a magic bullet. I don't think anything is, but it's a tool that we can use to support us. And so much of this is mind, right? Where the mind goes, the body will follow. So getting in the right mindset with the surgery, preparing. I look at this like an Olympic athlete, or like preparing for a marathon. Your body is going to go on this journey. And so the more that you can prepare it by optimizing your sleep ahead of time, looking at stress, meditation, using your essential oils, all of that, that's really, really important. Yay, so glad it was helpful. All right. Well, thank you for being here. If you have any questions, you can type them in the comments or reach out to me later. This is recorded. It's up on my Facebook page right now, so you can go over there and watch it or share it. I'll also post it over on YouTube as well. And if you've been following me for a while, if you've been thinking about adding these tools into your home, I would love to be the person to help and support you. We have a private VIP Facebook community. We do regular weekly continuing education classes, and I'll hop on a one-on-one call with you, and we will customize everything specific for your health and wellness needs. So I'm very passionate about empowering people. And if that's on your heart, let me know. I would love to help. All right. Take care, everybody. Oh, thanks, Debbie. Have a great rest of your day, and we will see you soon for the next class. Take care, everybody. Bye.